I want to introduce our first Educate session. We have Dr. Emma Wilder here to present on photobiomodulation therapy and how it can modulate inflammation in immune cells, increase cellular metabolism, and accelerate innate healing physiology and illuminate applications to Parkinson's disease. And that is a mouthful, and I made it through it. Woo. So Dr. Wilder is a naturopathic doctor who received specific training on functional approaches to Parkinson's from Dr. Laura Mitchley at Bastyr University. Make sure to stop by her table at the Empowerment Ball and welcome Dr. Wilder.
All right, thank you all so much for having me. I'm really excited to be here and share a new therapy, maybe to all of you, or if not most of you. So a disclaimer about this presentation, I'm going to be discussing information for an educational and research-based purposes, as well as my clinical experience. I'm not giving specific medical advice, but of course, if you have any specific questions to your particular condition, please come up and talk to me in the empowerment room. The therapy I'm talking about, laser therapy or photobiomodulation therapy, is currently not FDA approved for the use of Parkinson's. However, it is FDA approved for numerous other conditions, which I'll be discussing. And again, we'll be reviewing the clinical and research science behind using laser for Parkinson's. So for this presentation, I'll do a little overview, really quick intro, and then I want to get into the detail about what is laser therapy, how does it work, how are we applying it to Parkinson's. And then I will discuss briefly the supporting and complementary therapies that I also use in addition, not only to support laser, but Parkinson's as a whole. So I have a functional medicine clinic in Denver, and I really work on trying to treat the root cause of disease, or a functional approach or a holistic approach, not only to Parkinson's, but other conditions as well. And I really focus on promoting health, vitality, and longevity. I did have specific training with Dr. Laura Mitchley, who's also an ND as well as an MPH and PhD. She's received NIH grants for focusing on functional approaches to Parkinson's disease. And I also was trained with several different doctors over the years on class 4 laser therapy. So let's talk about class 4 laser therapy. Yes, photobiomodulation therapy is a mouthful. So in this presentation, I'll be using the terms laser or PBM. If you look up literature, you might also see it referenced as deep tissue laser therapy or high intensity laser therapy. Laser is the emission of energy in the form of light or photons. The specific laser that I'm talking about emits at the frequencies of 810 and 980 nanometers. We're going to look at the electromagnetic spectrum in a moment here, but that's on the spectrum of red light. Some red light is visible and some is not. When we look at emission, we're going to be in each treatment, depending on the area in which tissues we're targeting, we'll be adjusting for output and power, which can be measured as watts over time or joules. So let's look at the spectrum for a moment here. Let me catch up to where I am at. Okay. Here we go. Okay, so when we're talking about emissions of 810 to 980 nanometers, we're looking at the infrared spectrum. And if you look at the actual wavelength as it's measured in meters above the spectrum, we see that that wavelength is the wavelength that is the size of bacteria and our own cells. And that's what enables us to interact with tissue at that specific level. There are different classes of laser, and it's important that we really use the class that's appropriate to the tissues that we're targeting. So this is some of the details on what a laser might look like. So again, we're adjusting for time and watts. We're looking at continuous wavelength. There are different types of wavelength for depending on the laser. And then we're also adjusting for other tissues that we don't want to treat. So for example, in order for light to penetrate deeply into joint tissues, we actually have to go through skin, connective tissue, water, fat, muscle, tendons, ligaments, and a joint capsule to reach the joint itself. So it's very important that this therapy is very specific so that we're moving through tissue that we don't want to treat and we're actually reaching the target tissue. And again, we change this frequency and output depending on which specific area that we are looking at. The brain itself is very interesting. Unlike many other structures, we actually have to get through bone and a blood-brain barrier in order to reach the tissue that we're trying to target. If you think about a lot of other areas in the body, like a muscle, you don't typically have to go through bone to reach it. So the brain is unusual in that aspect. There are 3 other different classes of laser, classes 1 through 3. While they can be effective, this is a study looking at low-level laser therapy or laser that's looking at lower classes. We see that it's not as effective, especially when we're trying to reach tissue that's deeper. This study was specifically looking at a condition called plantar fasciitis, which is inflammation of the fascia and the bottom of your foot. So you might have pain in your arch, for example. And it showed that not only were pain levels more significantly affected by using a high-level laser therapy, we also saw improvement in function and quality of life for patients, which is something that we really care about when we're talking about not only plantar fasciitis, but specifically Parkinson's. I want to take a close look at cells and really discuss how we're targeting when we're using laser therapy. So this might go back to biology or chemistry for some of you. When we're looking at the anatomy of a cell, we want to focus in on mitochondria specifically within the cell and really the function of the cell. So proper function includes making proteins, repairing cell wall, being able to signal all the other cells in between. When we have different disease processes, some cells are damaged beyond repair, and we also need to make sure that we're cleaning up damaged cells or dead cells, and new cells are able to come in. When we talked about mitochondria, perhaps some of you are familiar with mitochondria, perhaps not, but mitochondria are very, very important for cellular functioning and for your entire body health. They are the powerhouse of a cell. You cannot make any energy and let the cell have normal function without properly functioning mitochondria. Within mitochondria, there's actually a region, it's called the cytochrome C complex, that is a chromophore. What that means is that this specific region in the mitochondria can actually receive photons of light, transmute it into electrons as the form of energy, and then it goes on to make the main form of energy that our cells use, which is called ATP or adenosine triphosphate. A lot of people might be familiar with this in the exercise world. It's very important to have properly functioning mitochondria. Muscle cells have hundreds or thousands of mitochondria within one cell, but it's equally important to have properly functioning mitochondria within neurons and neuronal tissue. Other targets, in addition to mitochondria, when we're applying laser therapy, laser therapy interacts with our blood vessels, and specifically with a chemical called nitric oxide. Nitric oxide is responsible for vasodilation, or the ability to allow blood to flow into areas and also exit. When we think about good blood flow, we need good blood flow for nutrient delivery, antioxidants, and any of the good stuff we need entering into our cells throughout our body, and that all gets delivered by the cardiovascular system blood flow. We also need good blood flow to actually bring waste materials out of areas. So anytime our cells are active and doing work, they're creating waste materials. And if cells are diseased or have had any kind of damage, they're going to produce waste materials that also need to be taken away. And this is really important because anytime we have different disease processes, it even could be something like you have a sprain or a strain injury. We see a decrease in blood flow, and that impairs tissue healing. So part of the way that the laser works is by stimulating this nitric oxide as well as angiogenesis, or formation of new blood vessels. Laser also interacts with a variety of immune cells and modulates the immune system. This is vital in any kind of regulation of inflammation, which is a really key process to a lot of different diseases, including Parkinson's. So the laser, and I'm going to go into a very specific immune cell we'll talk about here in a moment, but that's part of the efficacy, is not only interacting with these immune cells, but altering signaling pathways and inflammatory cascades that happen in disease. If some of you might, and you all know much better than I do because I do not have Parkinson's, but when you go through the day, what I hear from a lot of my patients is that you're fine, and then within a couple moments, you can be really downhill, and it can happen really quickly. And that's part of neural signaling and immune cell signaling, that there can be dysregulation in one part of the body, and then because of these signals and these cascades, it can derail the rest of your system very quickly. I want to focus on a specific cell in brain and neuronal tissue that's very important when we talk about laser. This is a microglia, or a specialized immune cell. When we think about the brain and we think about the nervous system, there are a lot of neurons that are involved in signaling and regular pathways. There are actually even more cells that need to support these neurons than there are actual neurons, including the microglia. And microglia are really important in maintaining healthy cells. So they're the cells that are going to signal repair work to be done. They can be helpful in delivering, like getting the nutrients from blood vessels to neurons. They are also our mini alarm system in the brain and the nervous system, which means if they sense any waste materials, toxins, dead or damaged cells, they send out signals to all neighboring cells that something is happening and we need to clean it up and we need to create repair. And so these cells are also part of what we're targeting with laser, not only damaged cells, but we're working on the whole network of cells that are supporting and are part of a really healthy, normal physiology. So now that we've looked at the detailed level, cells and mitochondria, microglia, let's take a step back a little bit here and see, okay, so if we're doing all of this, what are the clinical outcomes? What do people typically experience? The photo up here is just to show a little bit of a wound healing experience. Sometimes when we're working on deep levels, it's hard for people to always have that visual of what's going on. But similarly to what we're working on the outside, for example, this finger that we treated with a couple of sessions and had full repair, including full nail growth, the muscle came back and everything. That's the process that we're trying to work on deeper levels. So we're really modulating inflammation or promoting tissue and wound healing, improving blood flow, and ultimately we also see a lot of pain relief because of all of these processes. So here are a lot of examples of FDA-approved uses of Class 4 laser. I see a lot of these in my office, in my private practice. A lot of them you all might experience in addition potentially, such as neck and back pain, joint pain and arthritis, damages to soft tissue, including tendons, ligaments. Scar tissue is a big one. A lot of people have injuries or surgeries with significant scar tissue that hasn't healed properly, or there's poor blood flow to the area and people haven't really ever recovered. Interestingly, the FDA just came out with a new approved use, which is chemotherapy-induced oral mucositis, which happens when you have chemotherapy is a toxin to the body, very effective and really important treatment, but it also is toxic and damages a lot of cells. So people who have oral chemotherapy will have these very large, very, very painful sores. And so this is an FDA-approved use to treat, to improve that wound healing and accelerate healing. One of my favorite aspects about laser is that there are very, very few, if any, side effects and contraindications. In fact, most people that I work with really enjoy this session. The emission of light feels warm, and I have people fall asleep all the time during treatment. There are potential side effects, and I rarely experience this, but occasionally someone might feel sore. That's usually because we've increased blood flow to an area, and that part of the body is kind of waking up, almost if you think about like when your foot falls asleep and then all of a sudden you get blood flow again to that area. Contraindications, again, are also very few. I think the biggest one that for you all here is that if you have a DBS or deep brain stimulator, we cannot concurrently use laser therapy, and that's to be really safe so that we're not interacting or causing any alterations with what's going on with DBS. So now let's look really specifically at laser and Parkinson's. I want to just briefly highlight the general process of Parkinson's, not only in the brain and the nervous system, but also what's happening in the rest of the body. I have a lot of the common symptoms for each area listed here. I won't go in those detail. Again, you all know much better than I do because you live with it every day. But the general process we're talking about is a degeneration of neurons, particularly in the substantia nigra. That's a particular area in the brain that produces dopamine, and it has a few other functions as well. We're looking at brain and neuronal inflammation. We're also looking at abnormal foldings of alpha-synuclein proteins. And we'll go into a little more detail about that in a moment. But we see these abnormally folded proteins not only in the brain, but also in the spinal cord and actually throughout your entire body earlier on in the disease process. And we also see a lot of stress. When I say stress, we can definitely think about stress as the everyday type of stress, emotional distress. I'm also talking about stress in terms of balance between your nervous system, parasympathetic versus sympathetic response, and dysregulation in that causes long-term neuronal inflammation as part of that. A lot of the common symptoms, again, you all are familiar with. I do want to highlight that depression, insomnia, confusion, difficulty with word recall and processing skills are all also part of the neurological presentation. Depression can absolutely be situational, but it also can be biochemical. It can also be a process of dysregulated neurons and neuronal signaling. When we have all of these mixed in a cocktail, we see a lot of different dysfunction and ways that neurons can't properly function, including our dopaminergic neurons. And any of these things listed can actually impact cellular death and inappropriate signaling. So we talked about a little bit of these misfolded proteins and inflammation, but we're also talking about any kind of loss of connection between cells, excess production of glutamate and oxidants, and also any kind of microglial dysfunction. So all of these are happening. And when we look at a network of neurons, there are trillions of different connections that are modulated. And again, if one goes wrong, it really can start an entire cascade throughout the system. I also want to talk about Parkinson's as it relates to the whole body, including Parkinson's in the gut or the gastrointestinal tract. When I think about Parkinson's, I think about it in that functional medicine perspective, which is that it arises in the whole system and people experience symptoms throughout the body. There's a lot of research that's shown us that it might be the actual initial site of these misfolded alpha-synuclein proteins occurs in the gut. We have animal models that demonstrate that these proteins are actually migrating to our nervous system via the vagus nerve. The vagus nerve is a very special nerve in that it's actually a cranial nerve. It comes from your brain and goes directly to parts of your digestive tract. Most of the nerves in our body actually have to travel through the spinal cord and then exit, but this one is a little bit unusual in that it's actually a direct connection between our brain and parts of our body. We also see that there's a significant altered microbiome. A microbiome is the landscape of the gut. We have bacteria, fungi, yeasts, viruses, and a whole host of other characters. And a lot of them are actually really health promoting and are vital to our health and function. But we can also have pathological species and we can have overgrowth or dysregulation of the microbiome. And that's important in Parkinson's, as well as a reduced production of short chain fatty acids. These are really important in feeding our gut cells, but also in proper signaling to our brain. And the largest site of immune cells in our entire body actually resides in our gastrointestinal tract. And so again, when we talk about immune cells and inflammation regulation, it's really important to see that a lot of what happens and precedes diseases throughout the body occurs in the gut. These other symptoms I have listed are also things I commonly see my patients experiencing, including constipation, gas and bloating, indigestion. Loss of sense of smell is a big one that actually can be, Dr. Mishley talks about it as one of the hallmark of the first sign of Parkinson's before most people have any other symptoms. And sometimes it can exist 5 or 10 years before you even know that you have any kind of neurological involvement. I put depression and anxiety also as a symptom of gut dysregulation because the second largest site of dopamine production in our body actually occurs in our gut as well. And so we can produce a lot of neurotransmitters and signaling in the gut, and that's related to also how our brain works. So when we look at laser and delivering light, we are directly trying to stimulate the brain. We are looking specifically at the part in our brain, the upper brainstem, midbrain, where the substantia nigra is. We're trying to stimulate damaged dopaminergic cells. We're trying to increase the expression of protective genes. We're also looking at indirect stimulation, so we're trying to support those immune cells and supportive cells like microglia. An important aspect too of laser is actually influencing other areas of the brain that can take over some of the functions that we're losing. So it's important to stimulate the motor cortex. It's important to stimulate other areas in the brain that are a part of word processing and recall, like Wernicke and Broca's areas in the temporal regions of the brain. And we're also stimulating, of course, proper blood flow, lymphatic flow, and immune cells that exist throughout that entire area. This process is really tapping into the power of our brains to have neural plasticity, which is the capacity of the nervous system to modify itself functionally and structurally in response to experience and injury. So this is really a wide field of research, but this is part of why therapies like light therapy can be effective in regeneration, because it's promoting these connections between cells and allowing other areas of our brains to start taking over into learning. This is also why things like exercise and that fantastic movement of the cross body with our jab cross is really effective, because we're challenging our brain. Anytime you feel challenged, anytime you feel like you're learning something, something is happening in your brain. You're actually creating a new pathway, and you're challenging your brain to create a new connection between perhaps your motor cortex or your word recall center, like Broca or Wernicke's. So this is not only what laser is doing, but it's also what, for example, something like exercise can be doing at the same time. In addition to applying laser to the brain, because of this whole systemic process, also apply laser to both the gut and spine. We see that laser, when we apply it to the gastrointestinal tract, actually can decrease cellular toxicity from abnormal folded alpha-synuclein proteins. And we have evidence that shows it actually increases beneficial bacteria species. For example, bifidobacteria is also commonly a species that we're targeting, which really helps decrease whole body inflammation. And again, we're also trying to target improvement in blood flow, lymphatic flow, and immune cells, which exist throughout our entire body. This slide is perhaps most important for you all. Like, okay, so we're doing all of this. What do people experience? What are the typical clinical outcomes that I see? I typically see, this is over time, we see potential improvements in mood and clearer thoughts, decrease in fatigue or a little bit of that daytime sleepiness we were talking about. I've seen decreases in headaches. You can see improvements in digestion, particularly for people with Parkinson's. We usually struggle a bit with that constipation, slow transit time, so we can see improvements there. Over time, a lot of the neurological and movement symptoms can be improved, again, with coordination and balance, word recall and processing. And then, of course, a huge aspect of laser is decreasing pain. Now, if you don't have pain in your head before we start, we don't necessarily see a decrease in pain. But if we have joint pain and we're treating that, then we do see a decrease in pain. So a huge question I get all the time is, how many treatments and how long is this going to take, and what specifically does this look like? So again, let's recall that the neuronal pathways are very complex. We do need many doses, particularly if we're further along in the disease process, or if we have other comorbidities. So if someone comes to me, they've already had Parkinson's for 10 or 15 years, they also have 5 or 6 other conditions. That's a very different picture than if someone comes and they were diagnosed 6 months ago and they're otherwise relatively healthy, if that makes sense. Because the levels of inflammation and the levels of damaged cells we're working with are frequently really different. We do see that more sessions equal faster results, and we can see changes quicker. In terms of measurement, when we look at measuring outcomes, there are several different ways to do it, and I'll draw on some of the research and show some of the research outcomes that they're measuring. In my clinical experience, we do a combination of subjective reporting, so what the person and their caregiver might experience, what I observe, such as facial expression, rapid blinking, coordination, movement, and balance, as well as we can do assessments such as the MOCA or Montreal Cognitive Assessments, and MD USMDR, which is evaluating the Unified Parkinson Score, things like that. So let's look at some research outcomes of what we see when we apply laser. And this study, this is a study from 2018, was really highlighting that laser is actually addressing a part of the disease process that common drugs and surgical therapies are not, which is that we're really trying to provide neuroprotective effects, and we're doing disease modifying effects, including trying to restore abnormal neuronal activity, which is a very different pathway than a lot of common drugs such as Sinemet or DBS. This is perhaps one of the first randomized controlled trials on laser therapy for Parkinson's. This trial was held over 4 weeks. They were looking at treatment both intracranial or transcranial, so reaching the brain from outside, and also emitting laser through the mouth. The back of your throat is actually very close to your brainstem, and so we can treat going that direction as well. So they saw there were improvements with writing, dynamic step test, and 9-HPT, which is again another assessment for motor. And they saw the best improvement with people who are using these treatments 2 to 3 times a week. It's very promising that this study already saw results, and it was only 4 weeks long. And they also only applied the laser over each point for 33 seconds. I typically try to work with people for a block of 30 minutes, and we do as much laser as we can fit into that time. This study was looking, this is a rat study, and it was looking at the misfolded alpha-synuclein proteins and seeing if laser can actually modify not only the amount of protein, but the neurotoxic effect that these proteins have. And it showed that this was, again, this is just under a month. They were using a laser at a similar frequency, 808 nanometers. And they showed that the photobiomodulation therapy actually mitigated the dopaminergic loss, which was induced by the overexpression of these misfolded proteins, which again, that is our target. We want to reduce loss of these dopamine cells. This study was trying to assess, well, is laser actually modifying mitochondria? Because again, that's a very important part of what we're trying to do here, is really to decrease oxidants and improve capacity of cells to function. So we saw that this therapeutic strategy actually did modify mitochondrial function. And it also highlights that we still have a long way to go in terms of fully measuring mitochondria function. The biomarkers are really subtle because, again, this is much smaller than a single cell. And so we still have room to improve. There are a lot of upcoming trials. This trial was actually postponed due to COVID, so I'm really looking forward to, I'm hoping in the next couple of years, some of these trials that were in the works are going to be coming out. But there are a lot of different ways. I don't use a helmet in my office, in case anyone was wondering, but this is the concept essentially that we are emitting. While you can see in this picture that the light looks red, that's only so you can visually see. The frequencies that we're using are actually not visible to human eyes. So I want to highlight a few of the supporting or complementary factors to consider when we are doing in addition to laser therapy, and this is important for Parkinson's in general. Again, it's really highlighting the importance of what else we can do to support decreasing inflammation, modulating immune cells, and improving holistic health. I consider the following really our foundations of health, and I think we've touched on a few of these at another presentation, but I'll go over each of them in brief. Again, we could spend an hour or more on each of these topics alone, but we talked a little bit about sleep. Sleep is really important for a variety of reasons. I just want to call out an important aspect that while you sleep, your brain endogenously or on its own actually produces the most potent antioxidant that our body produces, which is called glutathione. And we see in Parkinson's a huge decrease or drop in glutathione levels in the brain and throughout the body. So it's really important to optimize sleep for a number of reasons, one of it being that we want each night to have regenerative neuronal activity to produce this glutathione, which helps to protect all of your cells, including your dopaminergic neurons. We definitely talked about exercise and movement. I specifically like movements that challenge the brain because we know then we're stimulating new pathways. I really like cross-body movements because, again, we're crossing those hemispheres and we're recruiting cells to help us with our motor cortex, motor function, and balance. And anything that's really rigorous is going to, I mean, we have really good evidence for that being very supportive, but it's very supportive also because we need good circulation to our brain. Our brain not only needs really good blood flow for any kind of healing and repair, the blood flow also stimulates lymphatic drainage, which takes away all the toxin and waste material out of our brain. In our brain, we refer to it as the glymphatic or glial lymphatic system. We have a whole body lymphatic system, but there's a specialized system within the brain as well. I really think stress management is so important to support a healthy microbiome, to support healthy neurological tissue. And I have many different strategies for that, but I think that has to be a really individualized process because what works for someone may not work for the other person. Positive relationships and community is a huge, important factor that really improves quality of life. And so I'm really glad to see all of you here today, connecting with each other, learning and being curious. And then the last point is, again, something that there's so much research on, but that toxins from our environment play an incredibly important role in not only Parkinson's, but in memory deficits and our health of our neurological tissue. Neurons in our brain are very, very sensitive to a number of chemicals and toxins. So I find it very vital that we really reduce the toxins that we input in our system, and we really support our system with processing through toxins naturally. So in addition to all these foundations of health, perhaps the other really big one is diet and nutrition. And so that's something that I work with a lot. And I'll highlight a couple important aspects of that that are really going to support our tissue healing when we're talking about applying laser. So one is that if we're giving our cells energy to then start producing repairs and growing new cells and creating new connections, we really want to give it the foundational building blocks so that they can also do this more effectively. And so we look at tissue repair. So that's going to be collagen synthesis, which is sort of our building blocks. And we need the following cofactors to actually complete that synthesis. So within collagen, we're looking particularly at the amino acids, proline, glycine, and lysine. And we also need vitamin C, zinc, copper, and certain types of connective tissue require silica as well in order to actually create those connections. And as always, antioxidants are very, very important. Whenever our cells are doing work to create new tissue and to create repair, they create byproduct and waste material that we need our body to clear away naturally. This is a clinical trial. It's a randomized double-blind placebo-controlled trial in Parkinson's, and they were looking at the effects of supplementing with omega-3 fatty acids, which is a high-quality anti-inflammatory source of fat, as well as vitamin E, which is an antioxidant. Some of the biomarkers they were looking at were scores for inflammatory markers such as high sensitivity C-reactive protein, HSCRP. We're also looking at total antioxidant capacity and glutathione concentrations. And we saw that with supplementation in people with Parkinson's that they improved their UPDRS scores, which we talked about very briefly, and we saw an improvement in all of these markers. We also saw improvements in insulin metabolism. So that's something I haven't talked a lot about, but regulation of blood sugar or glucose and insulin, which is a hormone that regulates that in and of itself, is very, very important for your systemic health and for modulating inflammation and neuronal health. Again, we could spend a lot of time on just that one topic, but that's an important part that comes up in Parkinson's a lot, and so it's one of the biomarkers that we can look at. I also think it's important that if we're stimulating the mitochondria and helping them to be really productive and healthy, that we also do mitochondrial support. So antioxidants from our foods and from herbs and from supplements are really important. I've listed out several that are key. And I've also listed out a few nutrients that are, again, they're just absolutely vital as cofactors for proper mitochondrial function, including magnesium, different amino acids, and selenium. We also should note that we need specific amino acids or specific proteins to actually build glutathione in our body. And we should also note that eating protein and protein distribution can also really interact with cinnamon. And so there's a really fine balance here between having really good nutrition and getting what we need, and the timing between our food and any kind of herbs or other supplements you're taking, your medications, and those interactions. All right, and here's again another trial. It's a randomized double-blind placebo-controlled trial taking a look at probiotic administration in people with Parkinson's. And some of the biomarkers are similar to other trials. So again, we saw decreased markers in inflammation, we saw improved glutathione levels, and we saw changes in that markers of insulin level and resistance, which is again a marker of like inflammation and blood sugar control throughout the body. And this again, we're seeing many more research studies come out tying in the entire body with Parkinson's. It's not just the brain and the nervous system, it's your whole body that's involved in this disease process in reducing inflammation. And it's really important that we treat all systems, and that's what I promote and do as a functional medicine approach, is to evaluate all of this together. So thank you all so much for having me. It truly is my pleasure to be here today. And I'm out there on a table, so if we have any additional follow-ups, if you want to come say hi and chat, I'm really happy to do that. I have lots of the references listed here. And then here's some information as well, and I know you all have that.
Thank you, Dr. Wadler. That was really informative. We do have about 10 minutes for questions. So if you want to raise your hand, we'll get a microphone over to you. We've got a couple over here. Okay.
Since Parkinson's is a lifelong disease, is this something that you continue throughout the whole process, or is it time limited?
Specifically laser therapy?
Yes.
It is something that is continuous. So what I've seen over the years is that we do a loading dose of treatments, meaning that we might be doing 1 to 3 treatments a week for a certain amount of time until we see that we've reached as symptoms continue to decrease, and then we reach what I would say about a plateau. And that plateau is going to be unique to the person and how long it takes. And then from there, I see people need maintenance doses. So it might be something that they need to come in once a month to get, once every 6 weeks. It just depends again on the person. And that's the individualized part of the medicine and the individualized part of the brain. But you're right, we do need to, I have never seen someone not need a maintenance dose, at least at some point within a few months.
There's a question over here.
Thank you. You recommend magnesium, which I have found very useful, not only to help relax, but in muscle recovery. There are many different types of magnesium. Some are more effective on some things than others, and some are just garbage. Can you elaborate on that a bit, please?
Absolutely. So when we talk about muscle recovery, I frequently, kind of the go-to magnesium for muscles is actually magnesium malate, which is the form that has greatest affinity for muscle tissue. We also have to consider, are we trying to deliver magnesium to the brain and the nervous system? And so then we might be looking at forms of magnesium in like the citrate or glutate forms. There's also a form of magnesium, magnesium oxide, which can actually cause diarrhea. So sometimes we want that depending on how backed up we are, but frequently that's not the one we're going for on the everyday. I also recommend actually delivering multiple forms of magnesium together. And I find that to be more effective sometimes, because when we have this question, for example, of I have really tense muscles. Well, is it that the muscle tissue, the muscle cells not having enough magnesium? Or is that the nerves delivering signals and talking to the muscles that is the problem. And that's kind of hard to tease apart sometimes. And so I frequently will pair actually forms of magnesium together so that we're treating both what the muscle might need and the nervous system or the nervous tissue, and then they work in concert together.
We have one over here. You mentioned that the presence of a DBS prohibited this kind of therapy. Is that because of the implants themselves? Like if you turn off the DBS device, does that mitigate negative impact?
So the reason we don't apply laser therapy when you have a deep brain DBS is that we don't have any clinical trials of what happens if we do. So we actually are just playing it really safe. And we say that if you already have DBS or a pacemaker, we don't apply laser over that area. Not only do we not want to disrupt the signal, even if it's off, we don't want to disrupt the machine itself, because that's not a simple procedure to get the DBS in. And it's really important that it works well and that we don't mess with it. So really, it's actually a first do no harm approach, more so than I don't have any clinical trials saying like what happens if we just turn it off and then we apply it, because I haven't seen any clinicians or research groups that are willing to take that chance, if that makes sense. Now, laser is safe over other devices. For example, I have several patients with metal in their back, maybe from breaking their, having spinal breaks or other surgeries that were kind of before other types of implantation, and that's safe. It's really the electrical component that we want to really avoid.
Okay, we have one more question.
Hi, I think I understood you correctly. You're doing the laser therapy on the brain. And I'm just curious because my focus is primarily in the gut and there are so many neurons in the gut. Have you looked at, or do you know anyone who is looking at doing laser therapy on the gut itself?
I do laser the gut as well, actually. Okay. Yes. So what I typically do with anyone with Parkinson's is we will be lasering the brain. I've started to slowly incorporate intraoral points so that we're trying to reach the spinal cord from several different angles. Because again, we have to pass through a lot of tissue to get to the brain. I frequently will treat along the spine itself to reach the spinal cord because of that site of misfolded alpha-synuclein proteins. And then I also treat the entire gut. For some people, because the site and a lot of symptoms are more manifesting in the gut, we might spend 15 or 20 minutes alone just on gut treatment. If that answers your question.
Thank you.
Okay, we do have time for one more. Are there any other questions? I see one over here. Michael, you've got her?
Yeah.
Hi, this is fascinating. I love learning about what you're talking about. What was my question? Oh, when you say clean up old cells, I have several questions. That's the first. Does that include scar tissue? And the other question is, how do you determine the target area?
Okay. So yes, so when we talk about damaged cells, that can include scar tissue. We do see improvements with scars, and a lot of that research is actually coming out of clinical trials, for example, like post-cesarean section or hysterectomies or other types of things where we can physically see that scar tissue. When I treat people with chronic injuries, it's more based on their report or potentially CT, MRI if we have that available. But a lot of times people will say like, oh, I have this injury, I can't ever physically move right. We'll do a physical assessment and evaluate that there's probably a disruption in the connective tissue and there's scar tissue within, and that's how we'll treat that area. When we look at treating other areas related to Parkinson's, so when we talk about, for example, when we treat the brain, it's based on an understanding of the pathophysiology of Parkinson's, where we know the very specific area, which is the dopaminergic neurons with the substantia nigra, that's in the upper part of the spinal cord at like kind of the base of the brain. So I know that specific area and we evaluate that with each person. And then when I'm treating other areas of the brain, so we're stimulating those connections, for example, Wernicke and Broca's area, which is really important in word processing and recall, that's a specific anatomical region of the brain, which is actually right around here. And so then we're targeting that area as well, or we might come up to the motor cortex so that we're really treating those areas. Is it so specific that we have like a pinpoint location? No, it's not. And it's not that specific, but we are treating that whole region. And again, it comes back to, we are treating directly, trying to treat some of the damaged cells or the specific regions, but we also want to treat the supporting cells like those microglia, who are going to help us a lot in cleaning up the surrounding areas and improving those signaling. And that's a huge part of how the laser works efficiently.
Great, thank you so much, Dr. Wilder.
Thank you.